Hi, my name is Dr. Elisa Jones. I'm a licensed clinical psychologist and associate professor in Department of Family and Community Medicine at the University of Illinois College of Medicine, Rockford. I'll be talking to you today about the Compassion Appreciation for Recovery in Everyone program, the CARE program. Thank you, Winnebago County Community Mental Health Board, and I have sent sales tax voted on by Winnebago County residents that support this program. Opioid use and overdose is a significant public health concern. We have seen an increase by 8.2% just from 2021 to 2022. There were over 3,000 opioid overdose fatalities, more than twice the number of fatal motor vehicle accidents, and more than twice the number of homicides. This increase has been attributed by the rise of synthetic opioids such as fentanyl. When we look at our prison population, we see that nearly 85% have an active substance use disorder or were incarcerated for a crime involving drugs or drug use. Winnebago County remains still an Illinois county with the highest overdose rate in the state. However, we have in recent years seen a decrease in overdose deaths in our county, with 64 deaths recorded in 2024 compared to 166 deaths in 2022. We hope that programs like the CARE program are contributing to that decrease. The purpose of our CARE program is to transition recently incarcerated individuals to behavioral health services and also connected them to community services. Our goal is to reduce recidivism and deaths due to overdose. This is a collaboration between University of Illinois College of Medicine, Family and Community Medicine, Winnebago County Justice Center, and UI Health Mile Square Health Center, LP Johnson, Rockford. LP Johnson, Rockford is a federally qualified health center. We provide integrative care. So it includes family physicians, physician residents, behavioral health team, as well as dentistry and pharmacy-related services and community outreach. This is our CARE program staff. We have for our substance use services, Dr. Rodriguez. For mental health services, myself and Cindy Brush. Anita Bramble is our peer recovery specialist. She is the first person to have contact with a justice involved individual being released from Winnebago County Justice Center. And Malia Lewis is our medical social assistant, and she identifies and connects these individuals to community resources. So our CARE program components, we really want to provide our justice involved individuals with a medical home. Okay. We have comprehensive services and are able to provide not only the medical care, but behavioral health services, as well as community service linkage and case management. This is our process. So when an individual will be recently released, Anita will meet with them and assess their needs. Along with Malia, she works both at our clinic as well as Winnebago County Justice Center, and she will do a social needs assessment with the individual who will be released. They are able to schedule our individuals with behavioral health services at LP Johnson Rockford. We provide same-day, next-day services for these individuals. We know oftentimes some of them are receiving behavioral services while they're incarcerated, but once they're released, they struggle to try to figure out how to continue their treatment. And so with our same-day, next-day services and really warm handoff and support, we don't want anyone left behind. Once they attend their appointment with either a primary care provider or one of our behavioral health providers, we do ongoing assessment of their needs because we know that for some of these individuals, life can change really quickly. And so we want to make sure that we're addressing their needs. So Malia will, continue to follow up with them and check on them and see, what worked out, what didn't work out, how we can best help them, provide them a lot of encouragement, reminders about their appointments, and support them in any way possible. The substance use disorder services that we provide are our medication-assisted treatments for opioid use disorder, alcohol use disorder, and stimulant use disorder. The type of mental health services we provide, solution-focused, supportive, and because many of our individuals also have a history of trauma, we also provide trauma-focused cognitive behavioral therapy. These are the type of community resources we connect our folks with, from housing to addressing food insecurity. And then we also provide some of what we call our special services. Unique to our program is a care phone program. So some of the individuals don't have a phone. And so, how can they receive reminder texts and calls if they don't have a cell phone? So we do provide those individuals who don't have a phone temporarily with a phone until they can get their own service. We also provide prescription support. We know how expensive it can be for some of these treatments, and so we also support them in being able to purchase their prescriptions. We also have a care package that some of those who may not have just some of the basic needs, like hygiene, things like that. In the wintertime, we provided blankets and just support some of those basic needs. And then we were invited to participate in that rideshare program, and we just started about February to help with transportation. Care program impact. So since the start of our program, we have provided services to over 700 justice involved individuals. They tend to be middle-aged, between 30 and 59, male, and identify their race as African American, Black, or Caucasian white. We have about 43.1% of our participants who have a mental health condition. 38.3% have both a substance use disorder and mental health condition. When we just look at this by sex, we see that many of our women in our program tend to have both substance use and mental illness, and the men in our program tend to have mental illness. The most common resources are generally housing, transportation, food, employment. We had about 30 participants complete a self-report questionnaire, a very brief questionnaire, just asks about, what services have been helpful to them, what suggestions they have for improvement or any needs that aren't being met. And by and large, we see that among this 30 individuals who completed the survey, mental health services, substance use treatment were helpful for them. We asked about barriers to attending their appointment. There were, multiple issues. Many of them, though, had no barriers, about 20%, which is nice. It looks like we're, doing pretty well in meeting their needs. But we still had quite a number of individuals who are having transportation issues. We're hoping with this rideshare program, it's still relatively new, a little less than 6 months. But since being able to offer the rideshare program, which is a partnership between Winnebago County Community Mental Health Board and Case and Health, we have been able to provide Uber services to 32 of our care participants, which has culminated in about 125 rides in less than 6 months. So qualitative feedback we received from our survey, just a couple of quotes to really highlight that, we're moving in the right direction and our patients feel supported. A couple of shout out to our providers here. I love that last quote. I really enjoy coming in. It really helps to have someone to talk to that doesn't judge me. So reducing the stigma, I think is so great. We, a part of this program, being able to do that is important, so that people are willing to ask for the help and know they're going to be supported. So providing behavioral health services in a medical home to our justice involved individuals being released back into our community, it does support reduction in overdose and associated deaths, decrease in recidivism, recovery and healing, and what we hope for our patients is growth and we continue to hope for their recovery so that they can be productive citizens in our community. Just want to acknowledge our additional care team members who are sort of in the back there, but it takes all of us to make care work. And so we appreciate every one of these individuals. We also want to thank Winnebago County Justice Center and UI Health Mile Square Health Center. Again, thank you to the board and thank you to our amazing residents that support this program. If you have other questions or want to read more about us, here are some websites for you to check us out, and there's a QR code to an article about us and an impact report from year 2023 to 2024. But also feel free to send me an email, and we can talk more about the CARE program. Thank you so much.